So I think what would be good is you mentioned that there'd been some things on social media and that sort of thing. So our concern here is making sure that people have access to, as you know, as far as possible, official information. But what I thought it would be good is, could you give us a bit of an idea, which will touch upon the things that have been in social media, but could you tell us the background to actually what's going on in hospitals with the staff, the doctors, the nurses, the support staff, what they're experiencing?
Sure.
So I know there's been question where people aren't sure about data and things like that, and perhaps if you could tell us what's going on in hospitals, for those of you who don't have doctor friends working in hospitals and other support staff, as I would, so I've heard it firsthand, could you tell us more about that?
Okay. Where will I start? Okay, so if you watch the news, BBC News, every evening, at some point you'll see a graph that they put on the chart on the television, which shows how many people have tested positive for the virus. And South West London is no different in terms of the shape of that graph. Over the last year, we had a big surge in people who were testing positive for COVID-19 through April, May, and then it tapered off through the summer period. But it came back with a real surge through November, December, and January. And part of that surge in the level of positivity, or how many people who had the virus, was why the government made their choices about the tiers of lockdown, and indeed the lockdown, the restrictions that we're facing now. The number of people testing positive, if I talk about South West London, at the height of that in January was about 14,500 people every week. So we were testing about 45,000 people every week. And of those people, about 1 in 3 were testing positive. Remember, not everybody who tests or who is symptomatic or has some symptoms of COVID gets tested. So we know that some people don't have symptoms, but overall there are sort of headline numbers. About 45,000 people were being tested every week, and about 15,000 of those were testing positive. Of that number, and again, I do want to reassure people, the vast majority of people who contract COVID do recover from the illness, but for a smaller number, they become unwell enough to be admitted to hospital. And we had, during that period of time, about 1,200 people, 1,200 people in the 4 hospitals in South West London: Kingston, Epsom, St Helier, St George's and Croydon. About 1,200 people each week were in hospital in our beds who were so unwell with COVID-19 symptoms that they couldn't go home. And then for a smaller subset again, they require ventilatory support or mechanical support. So that's a machine to help you with your breathing, or indeed the support of an intensive care doctor and nursing team to look after you. And during, again, the peak through January, we were looking at about 150, 160 people in South West London every week were in our intensive care beds. So all in all, we know that the virus for the majority of people is relatively straightforward, particularly if you're young. But if you are older or you have other risk factors, you're more likely to become seriously unwell, more likely to require admission into hospital. Of that, a subset require significant support to help them recover. And sadly, for some people, that isn't a recovery. That's that the illness has resulted in their death. And across the country, we've now gone through in the new year a level of just over 100,000 people have died as a result of the virus. So that's with the virus or having been tested recently for the virus. That's the number of people who've died. I don't want to go into too much around that because I know it can be upsetting for some people on the call. But it is very difficult for our nursing and medical teams because in addition to trying to keep the rest of the NHS going, so we still have to have cancer services running, we still want to run our opticians, we still want to make sure that people have access to accident emergency, we need to make sure our district nurses are still visiting, and they have this new amount of work on top of what would be their normal work to do as well. And I think it's quite disheartening, I think, for our nursing teams, particularly those that are in pardon me, those that are in places like intensive care or the acute medical unit, where they see the sickest people coming in, and high numbers of people coming in extremely unwell in a short period of time, and sadly some of those dying as well, has meant significant emotional burden as well as the physical burden of the work that they're doing. I've been a nurse for over 30 years. I have not seen, and so my background was in accident emergency as well. I have not seen a winter like we have had over the past year in terms of how busy teams have been. And it doesn't always come across if you're visiting hospitals or if you're visiting your GP, you may think that they don't look busy, but that's part of our job, is to make sure that we segregate people and how they're being cared for away from the public eye or away from line of sight. But I can absolutely categorically tell you our GPs, our district nurses, our physiotherapists, our nursing and medical teams in hospitals have worked their socks off over the past year, but a very difficult time over the last winter period to make sure that people are well looked after and they're safe. They do a fantastic job, and they're rightly proud of the work that they do. But part of the work we do is dependent on us as society working together. And that's where we come back to those very simple but straightforward messages about staying at home and not going out unless you need to, keeping your distance away from people if you are out and about, making sure that you're wearing a face mask. If you are spending time indoors, if you pop into a coffee shop or something like that, make sure it's the minimum amount of time, that those places are well ventilated. And as Florence Nightingale said, keep washing your hands.